Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be going over Silvercel Non-Adherent dressing. But first, if you could hit that subscribe button, it would be greatly appreciated, as it truly does help my channel grow. So let's get started. So this product is a combination of silver-alginate and carboxymethylcellulose. So it's sandwiched between a non-adherent film layers, which helps prevent sticking to the wounds or shedding fibers. It is a broad spectrum topical antimicrobial dressing. So indications for use. So this is for wounds with moderate to large amounts of exudate because it does have a high absorption property. So it also does have silver in it, so it's an antimicrobial. So we want to be making sure that we have signs and symptoms of infection. So using your nerds and stonies. If you're not sure what nerds and stonies is, please look in the description, and I do have a video there that explains how to determine infection. Because if we don't have infection, we don't want to be using an antimicrobial. So this is for local infection. Now precautions. So we want to avoid putting electrodes or conductive gels with silver products. Contraindications, if a patient has sensitivity or allergy to any of the ingredients, we don't want to be using it. We don't want to have it come in contact with surgical implants. Because it absorbs a lot, it will stick to the implants or bone. We do not want to be using this product if there's anything in the wound base that it could stick to. We're not using this for pregnant or lactating women. Silver products should not come in contact with oil-based products such as petroleum jelly. And silver products should not be on a patient when they're undergoing an MRI exam or radiotherapy, but you can apply it after. So first we're going to start by cleansing the wound, irrigate it with some normal saline, and apply a skin barrier if necessary. Because we're using this for a high or a moderate to high amount of exudate, you might have that peri-wound maceration. So if you do have that, just use a skin barrier. So we're making sure that we're protecting that tissue from any further damage. So you're going to apply it dry and cut the sheet dressing to the size of the wound. It can overlap onto the peri-wound a little bit. And you're just going to lightly layer it to cover a cavity, okay? So for packing, you can use the ribbon to fill the cavity, lightly fluff it, don't stuff it. Into any undermining or sinus tracts, and then just leave a tail of the ribbon so that it can easily be seen and easily removed. And then you're just going to apply an appropriate cover dressing to maintain a moisture balanced wound environment. So to remove, you're just going to gently remove it with forceps. Now, if you need to, you can flush it with normal saline to help remove it. So the dressing can stay in place for up to 7 days. So that silver does remain effective for up to 7 days. So depending on the amount of exudate is how often you need to change it. And the expected outcome is that signs and symptoms of local infection are resolved within that 2-week period. So that's all I have for this video. I hope you did find it helpful for your daily practice. And if you haven't done so already, if you could please hit that subscribe button, it would be greatly appreciated, as it truly does help my channel grow. So I'll catch you in my next video, guys. See ya.